So is there any preventive methods which are available? As I told you, there is no symptoms for early identification. Probably you might have white discharges or low back pain or a pelvic pain. Those kind of pains can happen. Other than this, you don't have any major signs and symptoms for this cancer. The identification only happens when you visit a gynae. Definitely anybody who is sexually active, and because majorly sexually transmitted infection also, if you're sexually active, probably you have to get yourselves annually checked at least once after you're crossing 30 years through a test called pap smear. So pap smear test should be done if you're more than 30 at least once in 3 years. If you're more than 45, at least annual checkup is definitely mandatory. It is a very simple test where the doctor puts in a small instrument called speculum to visualize your opening of the uterus, that is the cervix, and uses a small spatula to take a sample of tissue, the cells from the mouth of the uterus. And this is spread in a slide and that is sent to a pathologist. So the pathologist, the one who reads this slide and tells us whether there are any cancer cells present in our mouth of the uterus. This is how the detection happens. So is there any preventive measures to avoid getting into this kind of infection? Definitely avoiding smoking, multiple sexual partners, and lifestyle changes which can help you. Beyond that, we have certain vaccines which are recently available. I think the vaccines are available for the past 10 years, and anybody more than 9 years to 45 years, you can take this vaccine. We have two different types of vaccine. One is quadrivalent vaccine and a bivalent vaccine. Both the vaccines are quite efficient, but I would prefer a quadrivalent vaccine. Quadrivalent vaccine is more effective against 4 severe varieties of HPV virus. And bivalent is more effective on 2 different very important HPV virus. Any small child or a boy beyond 9 years of age can or should take this vaccine, and so that they are protected early age itself from this HPV virus. And if you're not taking this vaccine, please, if you're lesser than 45 years, please get yourself vaccinated. And this is the only way protect ourselves from this dangerous illness. So this disease is majorly a sexually transmitted disease. And definitely using a condom and avoiding multiple partners is something which can prevent you from acquiring this infection. It also can occur for men. For men, it happens as warts, and definitely they can also get into cancerous warts. The vaccine is there for the young boys and the girls, so both can take this vaccine from prevention from the HPV virus. And once you acquire and you're identified to have this cancer, then how do we treat you? We divide you into 3 different groups, that is mild, moderate and severe. So milder varieties, don't worry at all. You have a 100% cure from this. We do simpler identification. Probably we remove that tissue from your body, or probably we cauterize that tissue and get the entire cells dead. Thereby it doesn't spread further at all. And moderate variety, again, uterus can be completely removed, and the adjacent tissues, if they are not affected, probably those can be left alone. So just by doing a removal of the cervical area alone can definitely help you. Very severe illness is where probably you might have to go through surgery plus radiotherapy and chemotherapy is definitely needed for very severely infected cancerous people.